Hello and welcome back to my channel. This is Pelia Palace TV. If you are new in this channel, please do like, share and subscribe because you will find this channel really useful. Today, we will be talking about polycystic ovarian syndrome, Pcos. This is a hormonal syndrome that causes enlarged ovary with small cysts on the outer edges. Now, ovary is a gland in the female reproductive system that produces hormones and ova, that is egg, each month during ovulation. Ovaries are very important in fertilization, pregnancy, and menstrual cycle. This image, there are two ovaries. The first ovary represents a polycystic ovary, and the other ovary is a normal ovary. You can see from this image that the polycystic ovary is larger than the normal ovary, and there are cysts on the surface of the enlarged ovary. Cyst is just a fluid-filled sac, as you can see. Now, we have established that ovary produces egg, that is ova, each month during ovulation. The egg produced by the ovary travels through the fallopian tube down to the uterus, as you can see from the image. That is the uterus, where it gets fertilized by sperm that comes to it through the vagina. Now, Pcos causes a problem in the ovaries, making it difficult for them to produce hormones such as estrogen and progesterone. The ovaries also produce eggs, like I've said, every month. But with Pcos now, the ova may not develop as it should develop, or it may not even be released during ovulation as it should. Pcos affects women of childbearing age, that is, women that have started seeing their menstruation. And the thing is that many young women do not even know that they have Pcos until they get married or until they are ready to start giving birth. If you find this video interesting, please like this video now, share and subscribe, please. Now let's go further to what really causes Pcos. What are the causes of Pcos? The cause of this Pcos is not well understood, but we know for sure that both environmental and genetic factors play a key role in developing this disorder. There is this chemical compound called bisphenol A. This chemical compound is used in plastic production and in epoxy resin used to coat inside of food cans. You know, plastic we use for our food flasks, our water bottles, etc. Now, what this chemical compound does is that it mimics or stops the action of natural hormones. Now, exposure of a fetus to this chemical compound, that is during pregnancy, may lead to a long-term effect on the development and progression of Pcos. Now, in terms of gene, women with a family history of type 2 diabetes or a family history of this Pcos too are at higher risk of developing this infection. What are the symptoms of Pcos? How do an individual know that she has Pcos? First of all, is irregular menstruation. Irregular menstruation may be delayed menstruation, like it's supposed to come on the 1st of this month and you see it coming on the 10th of the same month. This may be missed menstruation, it did not even come at all, or abnormal pattern coming like 2 weeks interval, 3 weeks interval or so. So that is irregular menstruation. It is a symptom of Pcos, but this do not mean that any irregular menstruation will just say that, oh, I have Pcos. You have to rule out every other factors that may cause irregular menstruation, such as excessive stress, extreme weight loss, some kind of medication and all of that. You have to rule them out first before you start thinking about Pcos. Now, another symptom is hirsutism. This is excessive hair growth on the face and other body parts where men usually have hair, such as the chest, the chin, etc. Now, this hair is usually due to excessive production of androgen. Androgen is the hormone that is concerned with male sexual characteristics by the ovary. So when the ovary starts producing excessive androgen, this female tends to start getting some male characteristics in terms of hairs in regions where usually it is men that used to have hair there. Another symptom is ovarian cyst. This is the hallmark of Pcos, just as the name implies, polycystic. Plenty cysts on polycystic ovarian, plenty cysts on the ovary. Once an ultrasound scan visualizes a polycystic ovary, just know that this is Pcos. It's another symptom. And then infertility. A leading cause of infertility in women is this Pcos. It is just a leading cause because the ovaries are the ones responsible for producing these eggs, and when the ovaries are no longer functioning properly, the eggs may not be released, there will be no ovulation, and as such, the sperm will have nothing to fertilize for a woman to get pregnant. Another symptom of Pcos is weight gain, especially around the tummy. This is due to excessive androgen and also insulin resistance. We also have acne, that is pimple, usually due to excessive androgen production too. Now, Pcos can also cause anxiety and depression because some of its symptoms, such as infertility, weight gain, it may make a woman start feeling less of herself, start getting her depressed. And the society we are in, they'll want to stuff like that, and this will ultimately affect her relationship with people around her. Now, going further, how is Pcos diagnosed? Okay, first of all, we have the hormonal assay. Hormonal assay is usually done using the patient's blood sample, and then when there's increased levels of hormones such as this androgen, now it is suggestive that this patient may have Pcos. Another one is the ultrasound scan. Ultrasound scan usually shows polycystic ovary, and this is a hallmark of Pcos. And then we have the irregular menstruation. Okay, irregular menstruation, this can be attributed to Pcos after all other factors that may cause irregular menstruation must have been ruled out. Now, can Pcos even be cured? No, it cannot be cured, but we can improve its symptoms through medications. Medications such as birth control pill, it can help to regulate the person's menstrual cycle and then improve ovulation. Lifestyle changes also, such as eating healthy diet, exercising regularly, can also improve the symptoms of Pcos. And then there are medications that can reduce this pimple. Now, someone may ask, can I even get pregnant even though I have Pcos? Yes, of course. Absolutely, yes. You can get pregnant with the aid of fertility treatment. So, seeing a doctor as soon as possible gives you the best chance of getting pregnant. If you like this video, please